Hey everybody, I'm Marlon with Chronic Pain Warriors United. I hope y'all are all having an amazing week. Have had an amazing Christmas. I'm filming this on Christmas Day 2024. So hope you've all had an amazing Christmas and happy holidays. I'm going to jump right in real quick. Ever since we launched Chronic Pain Warriors United, one of the main or most common questions that we get is about cannabis, marijuana, weed, and is it an effective pain management tool or not? You know, we've seen a lot in the media with both state and federal government agencies and types pushing medical marijuana and marijuana as a pain management tool, and they push it constantly as a pain management and opioid reduction tool to replace traditional pain management tools that we've been using for 2,000, 3,000, 4,000 years. Um, and a lot of people just want to know before they go out and they start trying these things, is it going to actually help? Is it going to work? And for every individual, that answer is going to vary slightly, right? Because we all have a slightly different chemical makeup. We're all slightly genetically different. Everybody's going to have slight variances. But there have been quite a few studies done. There's been self reporting, like polling, done that has shown anywhere from 50 to 60% of marijuana users or medical marijuana users use because they are trying to self medicate for some type of pain. Now, a lot of people on the other side of this argument, and yes, they are on the other side of me, as you'll see shortly, pushing marijuana as a pain management replacement. They will point at these numbers and say, see, 60% of people or 50% of people are getting pain relief because they said that they're using marijuana to try and alleviate some sort of pain. That's not what that means at all. It's super dishonest. I know when I put it out like that, it should seem dishonest from them because it is. That 50, 60% is not saying that they get pain relief. They're saying that they have had either no other alternative option, cannot access traditional real pain management, or a million other reasons why they're using marijuana to try and alleviate pain. But access to true pain management through pain clinics, through your primary care provider, through specialists, and whatever else has become so ridiculously hard to access that Americans are trying marijuana products en masse just to try and alleviate some of their symptoms and pain. Now, there have been quite a few other studies that have shown that a lot of the what I call it relief that people get from marijuana products is a placebo effect. It comes from literally doctors, media, and everyone else telling you, hey, this is going to help with your pain. And then also, it is a psychoactive substance. It does alter your brain. It does give you a buzz, high, whatever you want to call it. And it can have some pain relief for some people. Absolutely, it can. And if it does that for those individuals, that's amazing. And that should be applauded. I love it. The fact that some people, or even a good number of people, are finding pain relief through something that they can easily access is something to applaud. And I love to see that because that is fewer people who are in pain, suffering needlessly, right? Anything that we can do to reduce people's suffering and help people is absolutely worth trying. And we should pursue every avenue that we can to do so. Now, what we don't want to see at Chronic Pain Warriors United is marijuana to be put up as another wall preventing access to traditional effective pain management for people that get no relief from things like marijuana or CBD. And it's probably a quite high percentage of individuals suffering from high impact chronic pain. Now, there are 50 million Americans last year said that they experienced some sort of pain for over a year, which equals out to being chronic pain. There were 17.5 million Americans who had chronic pain that was debilitating, changed their life, and radically affected how they live. I would have bet that those 17.5 million Americans do not find the same levels of pain relief that others do from medical marijuana or any other types of marijuana products. Now, real quick, I want to talk about those studies that I mentioned where they're talking about marijuana as a placebo effect. And they were done by the Journal of American Medical Association. And where I found this was in a commentary from Harvard Medical's website. They had some of their doctors and placebo specialists and study experts commenting on this. So I'm going to read some of what they said. Ted J. Kapchuk, director of the program in placebo studies and the therapeutic encounter at Harvard-affiliated Beth Israel Deaconess Medical Center, say that 5 times fast. Leave it to the medical profession, right? Says the findings from these well-done studies aren't surprising. With the exceptions of opioids, most pain-relieving medications are barely better than a placebo, he says. In fact, in clinical trials of common pain medications, such as aspirin and ibuprofen, placebos provide about as much pain relief as the actual drugs, which a lot of us probably have experienced, right? That's not to say that the active medications don't have psychological effects. Rather, the effects of a placebo rival or mimic those effects. They just work through different neurological pathways. Since the 1970s, we've known that if you give someone a placebo, different neurotransmitters are released in the brain and specific parts of the brain are activated. These neurotransmitters include endocannabinoids, which are structurally similar to the active compounds in cannabis. Exactly what triggers the release of these chemicals remains a bit of a mystery, however. You think? It seems like when we get down to the real issue of, hey, how is this working within the brain? What does this actually do? What pathways is it unlocking? What key paths is it turning? We really don't have the answers. The brain is such a complicated thing. We just don't know. So anyways, they keep going, blah, 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 blah. That's really the main point. Like, he's just saying these studies have been done. The placebo effect on medical marijuana and marijuana products is real. It's happening. And the only known painkillers that provide true effective relief, the independent of placebo effect, are opioids, which we have been using for thousands of years. And I don't think it takes a Harvard-educated doctor to say that. Once you start looking at just, people's stories and how it's affecting normal Americans out here, you can get enough anecdotal evidence pretty quick to show you that this is the case. It's also still illegal in some states, like mine, technically. Alabama has a medical marijuana law, but it was never put into effect. And the state has pushed it back year after year after year. We have no idea when it'll go into effect. Now, here in the state, we do have access to marijuana products that were made legal through the 2018 Farm Bill, which almost to a certain extent legalized medical, or not medical, but legalized marijuana products of many different kinds in all 50 states. And I have shops here locally to me in Birmingham that I use. If you don't have anything locally to you like that, it's technically legal to have this stuff delivered right to your door in most states right now. So you can access THCA products that have been made legal by the 2018 Farm Bill in almost every state. But that still does not get rid of the fact that for whatever reason, red tape, bureaucracy, and all that, it's still technically illegal in those states, especially to be consumed or whatever for consumption. Anyways, so you have states where it's not even technically legally accessible, even though it is. And then you have, excuse me, you have many, many pain clinics out there who are also saying, we do not allow the use of marijuana for our patients at all, period. And you cannot get access to pain management through those clinics that take that stance if you're using marijuana products at all. I mean, the CDC, by the way, this is a great example of the medical profession picking and choosing which things they want to follow from the CDC and which they don't, right? The CDC has no force of law. It is not something they are bound to in any way, but they will cherry pick what they want to use and what they don't want to use. And the CDC has very clearly said they should not be using drug tests or whatever to eliminate patients from pain management access because of marijuana use. They said that years ago, and they've said it again and again since. But these doctors still do it. So they do not really care what the CDC says on any given issue. If it benefits them some way, they'll use it. If it doesn't and they don't like it, they won't. Very little research has been done into the actual chemical pain relieving properties of cannabis versus other traditional pain management tools that we've been using for a long time. THC, which is the active compound in marijuana, is a psychoactive compound that can mess with some people's heads as well. I'm not going back to the old Reefer's Madness 1944 or whatever, but that's just a fact. If you smoke enough and you have a predisposition to some mental illnesses, marijuana can absolutely trigger those. That's just a fact. It can also be extremely mentally and physically unpleasant for a lot of people. So I'm going through these things that make it not an effective pain management tool for large numbers of people and why it shouldn't be being held up as a replacement pain management option for the traditional pain medications we've used for so long. Because it's not. It just isn't. Let's see, I had one more thing. If you or your loved ones do get major relief from cannabis, that's awesome as always. Like, we want to see that. That is amazing. We just don't like the idea of a wall being erected out of medical marijuana or marijuana access, making it even harder to access pain management. And that is what a lot of people who are pushing the anti-traditional pain management tools, be they opioids, be they steroid shots, or whatever they may be. And obviously people aren't sitting in line saying, you can't get these steroid shots. What they have done is they've made it so difficult to actually get into the pain doctor's presence that could give you those types of medications, and it's become so onerous to get in, so expensive, that even if they are trying to access that type of pain management, it's going to be very difficult to do so. Walls have been erected all around active, effective pain management, and we do not want marijuana to become another one. That's all we're saying, and we're pointing out that not everyone is going to get relief from it. Maybe even not even a lot of people. We just don't know yet for sure. But I have lots of anecdotal evidence, and I have myself. I personally get no relief from my pain symptoms from marijuana. None. Marijuana does not even really help me with my insomnia, much less somebody torquing the joints in my face to the point where they feel like they're going to tear. And other people have said, well, Marlon, how can you do this then? I shouldn't be. But I do this because I economize the motion of my face throughout the days when I'm not, or the day when I am. I don't eat the types of things that require a lot of jaw pressure. There's lots of things I do to make it to where I can do these videos, but after they're done, I will suffer. Anyways, that's it. We really appreciate y'all listening. We want to hear y'all's stories. If you've had success with medical marijuana products relieving your pain or cutting back, let us know. We want to hear those stories. If you're like me and you don't get any relief from it, hit us up down below. We want to hear those stories too. Get up there and hit that subscribe button. We're going to be talking a lot more about issues like this and the issues facing the chronic pain suffering Americans all over this country, how we can advocate for them, and how we can start tearing down these walls that the government and states and agencies and bureaucrats have erected in front of effective pain management. That is our goal. That is what we are setting out to do. Far too many Americans have died because they are not able to access true, effective, real pain management. Either because they went onto the black market and got overly strong drugs or tainted drugs, or because they decided to unalive themselves because they had no hope of help anywhere. And that cannot continue. That is what we want to see end. And anything that helps with that, including medical marijuana, we praise and we want more of. We just do not want them to become more walls to traditional, real, effective pain management. So hit that like button, hit that subscribe button, and get down in the comments and let us know your stories. I'm Marlon. We'll see y'all real soon. Thank you. Cheers.